how do you classify brilaroxazine as a drug, compared to what's already approved for schizophrenia?
So that's quite challenging. If you look at historical classification, pure dopamine targeted antipsychotic classified as a typical, and then later in late 90s, antipsychotics also developed, also showed serotonergic activity. But serotonergic activity, when you look at the currently available treatment options, they call it as a drugs developed later part of 90s and then till today with the serotonin dopaminergic activities, they're called atypical antipsychotics. Mm-hmm. Earlier to that, dopamine selective called typical antipsychotics. Okay. But a newer antipsychotic approved recently that is called Cobenfy, that is not dopamine active directly, even though the ultimate goal is to modulate dopamine activity, mm-hmm. but not directly modulating dopamine. So, but the ultimate goal in the treatment of schizophrenia is to modulate and then balance dopamine serotonin signaling in the brain. So having said that, the second generation drug or the drugs developed later part of 90s to today with the serotonergic and dopaminergic activities called atypical antipsychotics, but these drugs at therapeutic dose really do not have an appreciable activity for other than 5-HT2A.